Hello and welcome to the Best of Tri-State podcast. This is where we interview exceptional people in the health and wellness space. We learn more about them and what makes them unique. Today we are joined by Meredith Hall. She is a physician assistant. Meredith graduated from PA school at Sullivan University in 2017. She has 9 years of experience in family medicine, psychiatry, addiction treatment, and urgent care. She's currently opening her own clinic in our small community of Union County, specifically in Sturgis. I have the privilege of knowing Meredith personally and can say she's one of the most determined, genuine, and loyal people you'll ever meet. Meredith, thank you for joining me today. I'm curious, what got you interested in being a physician assistant and opening your own clinic?
Well, um, when I originally started school at Western in my undergrad, I had plans of possibly going to medical school. I ended up doing pre-med and agriculture at Western. I did not know what a physician assistant was at the time. Um, I ended up working in the agriculture field for several years as an extension agent in Crittenden County, and I absolutely loved it. But at the same time, there was something like deep down in me that knew I needed to be in medicine. So I was pursuing, uh, going back to school. And that's when I came across the career of a physician assistant. Uh, so I ended up checking out the school when I was actually working at a beef cattle, uh, at the beef cattle fair in, oh my gosh, I was in Louisville at the state fair working a beef cattle show, and I stopped by to check out the physician assistant school there. Um, and it felt right at home, and I thought, I'm going to apply here. If I get in, I'm going to be a PA. If not, I'm going to be an extension agent, and that's okay too, because I loved that job. Um, well, fast forward, here I am, a PA, in back where I want to be in Sturgis. I did some rotations here about 10 years ago. It was right before Dr. Sony retired. And once he retired, there, hasn't been any medical here, other than dental. Thank goodness we have that. So I wanted to bring healthcare back here, and that's been my mission since I graduated from school to finally work my way down here. So I purchased the building 4 years ago, and it's been a work in progress since.
Awesome. That's some big goals that you have there. That's pretty good. I'm curious, what are some of the most common issues you encounter in your practice?
Well, overall, I would have to say insurance, arguing with insurance, trying to advocate for the patient, and the insurance companies try to tell you otherwise. It's just very frustrating when you know what the patient needs, but then they can't get it because of insurance. Uh,
That is very super frustrating. We deal with that too.
yeah.
Very, very frustrating. So I know you're wanting to open just a general family practice there in Sturgis. But if you could stack nothing but one type of client on your schedule, what would interest you the most? What type of client would that be?
Well, so I'm going to be more of urgent care, but I'm also going to be able to take family, be a family practice as well. Uh, Due to the way my credentialing is and all the insurance. I'm urgent care, but I will be able to serve some patients as like a at their family practice. Uh, but my ideal patient or my favorite type of patient, well, it's hard to say just one because that's one thing about me. I like diversity, and I just think of how boring things would be if I saw the same thing every day. So, sometimes I enjoy doing procedures. I really like to suture. I like to do excisions and remove cysts. But then sometimes I like to see, like my psychiatric patients. I like to just sit and talk to them and just listen. So, I like the variety. So it's hard to choose just one.
I was going to say, it sounds like you like the variety and not one specific
Yeah.
type. I guess you would need that to be able to open your own urgent care clinic here in Sturgis.
Right.
So
Yes.
it will be a variety of things, I'm assuming.
Yes.
Um, what does the journey look like for someone to know when they need to come see you or someone similar?
Well, since I am structured like an urgent care, I will be accepting walk-ins. So if wake up not feeling well in the morning, cough, sore throat, flu-like symptoms, those types of things, you can walk in. You can also call, make an appointment. We'll be able to offer, it's called CLIA-waived testing. So that means we're going to do we'll be able to do like strep test, flu, COVID. We'll be able to check for like urinary tract infections. Um, we'll be able to do drug screens, mono spots. We'll also be able to offer, it's called health tracks. So that can check for all types of their viruses, anything through swabs or urine. We can send off to check for viruses and bacteria and have the results in 24 hours. Uh, so, yeah, or if um, you cut your might need a few sutures. You can walk in. We'll get it fixed up for you. That type of thing. Um,
Awesome. That's great to hear that you're going to be able to offer those rapid tests and results right there in the clinic
yes.
for the patients. That's true. That's really awesome. Um, do you have any patient success stories that stand out to you that you'd like to highlight?
Um, I worked in addiction medicine really all throughout my uh, into my ninth year of practice. And one of the most rewarding things for me was seeing these patients get clean and sober
Mhm.
and watching them get their lives back. Like
Mhm.
watching them be able to, have their careers back, have their families back, and then discover like how beautiful life can be without drugs and alcohol. Um, so that's a big thing. Another patient that comes to mind is a patient he was from El Salvador, and he moved over here. He became diabetic due to our lovely American diet, and just having the privilege to be able to teach him about what to eat, what not to eat, and watching him get his blood sugars under control and get out of the diabetic range. Uh, those types of stories too are
Uh,
what I'm in it for.
those sound like some very rewarding experiences. I bet they are.
Yeah.
Um, can you share any recent advancements in your field that find particularly exciting or promising?
Recent advancements. Well, in the psychiatry world, um, ketamine therapy is being used to help particularly patients with treatment resistant depression and also PTSD. So a lot of veterans, suffering with PTSD uh, that have not had any luck with any other type of therapies or medications. We're seeing a lot of success, with the ketamine therapy. The clinic where I was at did some of that, and I personally did not do the ketamine therapy, but I've witnessed some successes. So um, another thing that's maybe it's not so new in the physician assistant world, but physician assistants that work in the cardiothoracic surgery, they're harvesting the vessels for like bypass surgery. So the physician assistant is in there getting the vessels ready for the cardiac thoracic surgeon, and it saves the time, like less time that the patient has to be under anesthesia. And I just think that's really, really neat that a PA, can do that.
That's awesome. That sounds pretty intense. Um, w- so you're opening your urgent care. What is the best ways for your patients to get in contact with you if they are in need for your services?
Yes. So the best way is phone call. Uh, so I've got my phone numbers are posted on the Facebook page. Um, my office number is 374-4040. I also will offer an after hours call. Um, if something can't wait until the next day, you're welcome to call the number, and I'll try to help you the best I can. Maybe set up like a telehealth appointment that we could do after hours. I will be able to offer telehealth, so that's another um, thing that I can bring to this area. I always would prefer to see the patient in person, even if it is just like a visit for your like depression medication, because you can just pick up on so much of the patient that's overall well-being, in person. But if we need to do telehealth, it can be an option. So my after hours number is 213-1001. And again, that's on the Facebook page as well.
Awesome, Meredith. Is there any other messages you would like to put out here for us? Anything else you want to go over?
I just I just want everybody to feel welcome here. My my mission is healthcare with a front porch feel. When I say welcome y'all, the y'all means all. It's all inclusive. I want everybody to feel heard, and I look forward to being able to spend time with you. And just like my slogan says, modern medicine with an old fashioned touch. So I want to have that old fashioned touch there, back when people or providers could actually spend adequate amounts of time with their patients.
Awesome. Well, Meredith, thank you for joining me today on this podcast. I really appreciate you taking the time out of your busy schedule. I know you are busy trying to lay your final plans in place for your clinic to open.
Thank you.
Congratulations on all of that success, and I can't wait for it to open.
I can I can I add one more thing? I just thought of
Absolutely.
yeah, thank you. July the 26th is going to be our grand opening. It's on a Saturday. I'm getting ready to make a post about that as well. So July 26th, it's from 12 until 3. So we're going to have the Livers ice cream truck. We're going to have some cupcakes from Daydream Cakery, a bakery, and lots of finger foods. We'll play some cornhole and just hang out and let you guys see the clinic, talk to you about what I can offer. Um, and then July 30th, we will have a ribbon cutting with the chamber. So that's a Wednesday. And during that ribbon cutting, I won't be able to socialize much because I'll be seeing patients. But during the lunch hour, we'll have the cutting. We'll offer punch and uh, that type of thing. So come on out. I look forward to meeting you guys.
Awesome, Meredith. It's exciting stuff. I wish you all the best, and I'll be seeing you at the ribbon cutting.
All right. Thanks,
See
Brandon.
you. Bye.
See you.